So, knock, knock, knock. Hi, my name's Mary. I'm going to be your nurse today. I would ask the patient his first and last name, and I would double verify it, and I'd ask if he's allergic to anything. So we're going to go ahead and do a dressing change on your central line. I'm going to change a port, and we're going to go ahead and give you some medication. I'd ask him if he had any questions, any concerns, and I'd answer any of those that he did have. I would provide privacy, and I'd wash my hands. So I'm just going to go ahead and get my stuff set up. So I'd go ahead and open my bag. And I'd go ahead and put a mask on for myself. And I would put a mask on for my patient too. And I'd ask him to turn his head away from the insertion site if he can't wear a mask, but in this case he can. And go ahead, put mine on. Okay. Go ahead and don the gloves. I'm just going to go ahead and get my sterile gloves out, just so they're ready. So I would go ahead and remove the central line dressing, and I would pull towards the central line. And I would also anchor the catheter, and then my final, I would tear it away from the catheter. I wouldn't tear it towards, because then I could pull out the catheter. And I would dispose of my material. And then I would go ahead and take off my gloves and get my sterile gloves out. Chloroform. I'm going to go ahead and clean the insertion site for a full 30 seconds, and I would work my way out from the site and just scrub vigorously for again the full 30 seconds. And then I dispose of that. And then I'd go ahead and get my new dressing. And before I got my dressing, I would have gone ahead and put my initials on it, dated it, and put the time. So that way I wouldn't have to write on the patient. And then I would apply pressure away from the catheter and just smooth out any wrinkles or any air bubbles that I did see. And this isn't necessarily the right size of dressing, but it's what we had. But it would be a bigger dressing, and I would put it over the catheter and the surrounding area, so that way it would anchor the catheter down and I could still assess the site. And I would go ahead and assess the site before I even put on the dressing, just to see if there's any swelling, redness, any like irritation, anything to be concerned about. And then I would go ahead and dispose of my gloves. And then, so I'm going to go ahead and change a port. I would provide hand hygiene, and I would go ahead and just get, this would have a cap or like a foil that I would take out of it first, so that way it would always be sterile. But for this purpose, I'm just going to pretend. And then I would go ahead, and before I did the dressing change too, I would always make sure that the catheters are locked. The ports are all locked, which they are. So I go ahead and don gloves again. I'm just gonna grab them real quick. Now I would go ahead and hook up your normal saline. I would go ahead and scrub it first before I hooked it up. So scrub the site vigorously for like 15 seconds. And I would let it air dry. And I would also let when I cleaned around the catheter, I'd also let it air dry. I wouldn't blow on it or fan it or anything like that. So once that was dry, I'd unhook my line and I'd pull back to see blood return. And then I'd go ahead and flush it to check for patency, which it looks good. And I could go ahead and keep this on here. And I could go ahead and close my port again. And I would unscrew this. And go ahead. And I would take that out of the package because it's still sterile. And I'd go ahead and do the same thing. I'd pull back just to make sure, I'd unhook it first. Just to make sure that it's patent. And I would go ahead and administer my saline, which it looks good. I'm going to go ahead and take this off since our insertion site is covered because it's kind of hot. So, and make sure it's still closed, which it is after I did my, changed my hub. And then we also have a medication that we're going to give to you today. And prior to this, I would have drawn up the medication. I would have checked its compatibility if, say, we're running like normal saline through his line. If he's receiving any other medications, just to make sure he's not allergic to it. Nothing is like will interact with each other, just to make sure no like adverse reactions would happen. So I already have my medication, my 2 milliliters drawn up, and I accidentally got some out. And before I hooked up my normal saline and changed the port and checked for patency, I would also like beat it a little bit just to make sure that there's absolutely no air bubbles. So I could go ahead and scrub the hub again just to double check, just to double verify everything. And make sure it's clean. And since I already flushed the site once with the normal saline, I'm just gonna go ahead and hook up the medication. But if I didn't change the hub, or if I was just giving a medication, I would go ahead and first flush it with like normal saline first, and then do my medication. And then prior to giving my medication, I would have looked it up in the drug guide and seen how fast the rate we could give the medication. So for example, say we could give it over like a minute or 2 minutes. So I would watch the tallies on my syringe, and I'd always use a 10 milliliter syringe. And I would just watch the tallies and slowly administer the drug over the given time. And yeah, and then, well, of course I would unlock it first. And then I would give the drug. There we go. And then I would lock it again. And then I could undo my drug and dispose of my equipment. I would also raise the bed to my preferred level. It was already raised for this sake, but I would raise the bed, and then I would ask our patient, I would remove his mask, ask the patient if he had any concerns, anything else he needed for me to get. I would document what I did. I would document the medication I gave, what time I gave it, where I gave it, what port I used, the dressing change I did, and the port that I changed, and then yeah, clean up, lower the bed, put the call light in place, and we're good to go.